Hi, Assalamualaikum to sir and my fellow friends. Today I'm Norhani Sizat bint Abdul Halid and with my friends Majidina and Hadira going to present about the ABO blood group system. So what is the difference between the others blood group? So each of human have the different blood group due to the presence or absence of certain protein molecule called antigen and antibody. Antigen are located on the surface of RBC while the antibody are located in the blood plasma. Blood group is commonly inherited from the parents. ABO and RH system is crucial for blood transfusion. Not all the blood groups are compatible with each other that could result in the blood to agglutinate and causing the fatal reaction. So what is the indication for ABO blood group? First, we have the blood donors. It can be threatening if we transfuse the wrong ABO blood group to the patient. It will bring harm and fatal reaction to the patient who received the wrong ABO blood grouping. So second is the prenatal patient, which is determined if the mother may have the baby who is suffering of ABOHDN disease, which is the hemolytic disease of the newborn. There is the transplantation candidates and the donors, which is the transplantation candidates and the donor must be compatible because the ABO antigen are found in the tissue as well. It means that the ABO, the transplantation patient and then the candidates must be compatible because of the ABO blood group ABO blood group are present in the tissue as well. So next is the newborn. If the baby demonstrate the symptom of HDN, hemolytic disease of the newborn, ABO group need to be determined RH and the others. So as the ABO as the HDN disease are detected in the baby, the mother of the baby have to do a test to determine what is the RH of the mothers and the baby as well. So five is the paternity testing, which is the inherited of the ABO blood group is the specific and serve one of method to determine likelihood that accuse the fathers is the fathers or not. So if the paternity testing is like the we really want to know who is our father or who is our parents are. So the next is the transfusion recipient, which is reassured that the donor's blood group ABO is compatible and safe for the donation. So the next is the what is ABO blood group system. ABO blood typing have the four type, which is A, B, AB, and O null. So ABO genes, A and B genes are found on the chromosome 9, inherited one gene alleles, each one of from the parents, and A, B are codominant alleles. All genes are signified from the lack of gene A and B antigen. O is the heterozygous, while those who inherited AA is homozygous. I give an example such as if the mother is an O blood group and the father is A, so the children might have A or O blood group. But if the mother have O and the father is O, so they might have the O blood group, which is known as homozygous. So codominant genes. If one individual have both A and B genes, they will possess both of A and B blood group antigen alleles. Alleles term A produce the A antigen, while the alleles term B produce the B antigen. Alleles O, which is non-functional, produce no A or B antigen. So it means that uh, if the if we have the alleles term of B, it will produce the B antigen, which we will have the B blood group. But if the A will have the A antigen and produce the A blood group. But if O it is non-functional that will not be producing any A or B antigen. Next is the ABO antigen genetics. ABO and H genetics. ABO and H antigen presence or absence is controlled by the ABO and H genetics. So gene at three separate loci control the occurrence and the location of the ABO antigen. The ABH antigen on the RBC is controlled by the H antigens by H genes, and the ABH antigen in secretion are controlled by the SE antigens. ABO antigen genetic is H is the H and H small h alleles. H is an amorph, H mini is an amorph. SE gene is the SE and SE smalls are alleles. So SE smalls is the amorph, and then the ABO gene A, B, and O are the alleles.
So on this slide, there are two antigen, which is H antigen and A and B antigen. So H gene is encode for an enzyme that adds sugar fucose to the terminal sugar of the precursor substance, which is protein and lipid form on oligosaccharide chain. H antigen is a foundation upon which A and B antigen are built. A and B gene code for enzymes that add immunodominant sugar present at the terminal end of the chain and confer ABO antigen specificity to H antigen. A and B antigen A genes codes are for enzyme transferase and add an acetylgalactosamine to terminal sugar of H antigen, and acetylgalactosamine transferase, the name of the transferase, and B gene code for enzyme that add D-galactose to the terminal sugar of the H antigen, D-galactosyl transferase.
Okay, I'm Kira. Now I'm gonna explain about characteristic of ABO antibody. So basically, antibody is belong to the IgM class of antibodies, which are largest and typically form a pentamer, five antibody molecule joined together. Some may also be IgG, especially with a repeated exposure to the antigen like during pregnancy and transfusions. So we have three the characteristic of ABO antibody here. First one is natural occurring. Is unlike other antibodies, ABO antibodies are usually produced without any pure exposure to the corresponding antigen. So the second one is about agglutination. So ABO antibodies can cause the agglutination clumping of red blood cell if mismatched blood is transfusions. This reaction occurs because the antibodies bind to antigen on the surface of red blood cell. So the last one of the characteristic is about temperature. So ABO antibodies primarily is IgM are most active at room temperature and below. However, IgG antibody can react at body temperature. So that's it.
So next is about subgroup of ABO. So we have a three subgroup, type A, type B, and type O. So I will explain about the subgroup of type A. Type A have three. First one is A1, is the most common subgroup of blood type A, accounting for about 80% of individual with type A blood. And next is about A2, a less common subgroup making up about 20% of individual with type A blood. And A2 cell express fewer A antigen on their surface compared to A1 cell. And the last one about the type A is a rare subgroup. They have A3, AX, and AN and others. This is are very rare and exhibits even a fewer A antigen or different antigens. So for the next one is about subgroup of type A. We have a few, just four, B3, BX, BM, and BEL. These are rare variants of blood type B, characteristic by different in expression of B antigen on the red blood cell. So the last one is subgroup of type O. Type O typically does not have subgroup as it lacks both A and B antigen on the RBC. So now I will explain about the discrepancy of ABO blood group system. So ABO blood group system discrepancy occur when there are an unexpected reaction or result during blood typing test, leading to the confusing about an individual through blood type. This discrepancy can complicate accurate blood typing and transfusion compatibility. There can arise from various factors. So this is causes of ABO discrepancy. We have a few in here. First one is technically error. It can cause by incorrect sample labeling. And number two, we have patient specific factor is give because of wake of missing antigens. Number three is a mixed field reaction. It's happened from a previous transfusions and present of donor cell with different AVO antigens. And number four is cool auto antibodies. This can cause an agglutinations at the room temperature, complicate the reading of ABO test. And the last one is protein antibodies and protein abnormalities is because of condition like multiple myeloma can causes lux formations is taking of red blood cell due to high proteins level in the blood. So for the last part for I will explain is about laboratory tests. We have a forward typing and reverse typing. So forward typing basically is test determines the presence or absence of A and B antigen and red blood cell. For example, if agglutination occur with anti-A serum, the blood type is A. Basically, is how easy it is lah. And then for reverse typing, this is a test defect the presence of anti-A and anti-B antibody in the plasma. For example, if there is agglutination with A1 cell, it indicate the presence of anti-A antibodies for confirming blood type A. So we have a chart here. So basically, that's it from me. Now I will pass to Masjidina to take over for the case study part. Thank you.
Okay, thank you, Dira. So I may continue for the case report, which is about discrepancy in ABO blood grouping in a blood donor. Mm. So as you can see here, this is the patient information, which is 46 years old male that was very healthy with no significant medical history. So the patient history is the donor had an unremarkable medical history with no reported disease or medication that was being used. So the sign and symptom, the donor was asymptomatic because he was healthy individual that was presenting for the routine blood donation. So here is the diagnostic approach that was being used, which is the forward and reverse typing to prompt further investigation. The incubation study aimed to enhance the potential weak antigen antibody reaction. And the last one is the absorption elution assay that was utilized to confirm the presence of the weak B antigen on the RBC. So here is the laboratory test that was approached, which is, I said before, we have a forward typing and reverse typing. So the forward typing is we using the sample of RBC testing, and the result is they will show that no agglutination with anti-A, anti-B, and anti-AB. antisera. So we can conclude this must be the group O. But as you can see here, the reverse typing that was using by serum testing show the presence of potent anti-A antibody at the room temperature and no anti-B agglutinate at all. So this is not compatibility and was shown discrepancy. So for the incubation study, the blood sample were incubated with known antisera, which is the group A, B, and O, at various temperature and also the time interval to enhance the antibody reaction. So the last one is the adsorption illusion agglutination assay. It was performed to confirm the blood subgroup and it was detect the donor have a weak B antigen on his RBC red blood cell. Okay, so this is the final outcome and treatment. So the final outcome was the donor was identified as having a rare B subgroup phenotype, which is also was characterized by weak expression of B antigen on his RBC. So what is the treatment? There was no treatment that was necessary as the donor because he was healthy and also asymptomatic, and also he was being advised to receive the type O RBC in case of a future transfusion because it was to prevent the transfusion reaction in his blood. So his blood was donation was flagged because for special handling to prevent the ABO incompatible transfusion and also to give to another recipient. Okay, so last but not least, we have preventive measure. It is because to prevent the similar discrepancy, and it is also essential to implement through blood typing protocol in both donor and recipient blood screening processes. The blood bank and laboratory also should routinely use advanced serological and molecular techniques to detect the weak antigen expression that might be missed by standard testing method. Because in our blood, we have a lot of different subgroup that we might didn't know at all. Okay, so additionally, blood donor with unclear or atypical result should undergo further testing to confirm their blood group before being classified and used for another transfusion. So to ensuring accurate ABO matching is also crucial in preventing hemolytic transfusion reaction and also can improving transfusion safety. So the last one is the conclusion. This case was highlight the important through blood typing and subgroup identification to prevent the transfusion error. So the routine blood typing method may not always be sufficient, especially in case of weak antigen expression or rare blood subgroup. So the laboratory must implement comprehensive testing protocol to accurately identify such cases to ensuring transfusion safety for both, which is the donor and recipient. So by incorporating advanced serological and molecular technique, the healthcare provider can also enhance the reliability of the blood group, determination, and also can minimize the risk of transfusion related complication in future. So here is the reference that we conclude of this research. As you can see here. So yeah, bye.
Alright, so that's all from us for the topic ABO blood group system. So thank you and bye.